Welcome back. After some time on assignment, Africa 54's health correspondent Linord Moudou is back with some new information on HIV. Hello, Linord.
Hello, Vincent. Hello, everyone. The Democratic Republic of Congo has adopted a treatment plan to help prevent new HIV infections in children, known as Option B+. The new approach simplifies the anti-retroviral treatment regimen to one pill daily for HIV-positive pregnant or breastfeeding women. Experts say Option B+ helps ensure that mother-to-child transmission is reduced to less than 5% for all future pregnancies while improving the mother's health. DRC is among the first African countries to introduce the innovative approach. At the St. Bernadette Health Center in Lubumbashi, a town in the country's south, expectant mothers living with HIV are able to access this new treatment. Alain Nzungu is a nurse at the health facility.
With Option B+, nurses like me can prescribe anti-retroviral treatment for pregnant women living with HIV under the Prevention of Mother-to-Child program. We advise them to take one pill per day. We advise them to take their anti-retroviral medication during pregnancy and childbirth. After giving birth, the mother will continue taking the anti-retroviral treatment for the rest of her life.
The nurse told me that if I take this medicine, it can prevent my child from being born with the HIV virus. He told me that the baby will also have to take the medicine until he's 1 month old, but I should continue taking it after my child is born. This medicine gives me more reassurance that my baby will be fine, even though at first I didn't believe that it can help.
And Option B+ programs have already been rolled out in other African countries, including Cameroon, Ethiopia, and Namibia. Now to West Africa, Cote d'Ivoire is making great strides in preventing mother-to-child transmission of HIV. However, more than 2/3 of eligible pregnant women living with the virus are not receiving anti-retroviral therapy. The country is now working to increase access to treatment as well as prevent AIDS-related death. This group of young mothers and expectant women are attending a discussion program on HIV in the village of Labo. It lies about 100 kilometers from Cote d'Ivoire's political capital, Yamoussoukro. Athanase Kwaku is a community health worker in the region. Along with his colleagues, they provide support for pregnant women and children.
It is necessary to monitor expectant mothers because they can pass on HIV to their unborn child. So we monitor them and advise them to give birth at the hospital to prevent the baby from getting infected. We want their child to be born healthy.
HIV testing and antiretroviral medicines can only be provided by a doctor or a midwife within a health facility. For many women in rural areas, this poses a challenge, as they often have to walk long distances to access the health centers. Community health workers here play a critical role in motivating pregnant women and their partners to get tested.
Only midwives can carry out HIV tests in some rural areas, but there is no HIV testing at the community level. So this remains a problem.
A recent report indicates that Cote d'Ivoire has made remarkable progress in decreasing the number of new HIV infections among children. However, more than 2/3 of eligible pregnant women living with HIV are yet to receive antiretroviral therapy. HIV-related stigma and discrimination remains a challenge, often preventing people from getting the treatment they need. A support group run by an NGO known as Femmes Actives de Côte d'Ivoire is trying to help children learn how to take care of their health as well as lead normal lives. 13-year-old JEANNE is an orphan and lives with his aunt in Abidjan.
In 30 years, I imagine my life will be perfect, with a good job, my closest friends, my family, and everything else.
Cécile Aminata Traoré, a social worker at the organization, checks on the children daily.
Young people need support, social, physical, and moral.
Cote d'Ivoire is preparing to roll out life-saving antiretroviral treatment to all pregnant women living with HIV. This will enable more mothers to stay healthy and prevent HIV transmission in future pregnancies. That's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com. Back to you,